Angelina.
Hello.
Thank you for coming in. I'm going to go ahead and take a look at your file here. Last time you were here, it was about 2 months ago. Okay. Can you please verify your date of birth?
July 21st, 2005.
Okay. And any changes in your medications?
No.
Any new allergies?
None, just seasonal allergies.
Have you had any complications since the last time I saw you?
I've noticed some tingling kind of like on the back of my arms and numbness. Same thing with like my kneecaps as well. After some time of being in like the same position for a while, I just kind of feel like a numbness or tingling.
Okay.
And I guess along with that, when I wear like bigger headphones, I've noticed like some numbness at the top of my head as well.
All right. It does sound to be neurological. I'm going to ask you a few questions to see if we need to test any more nerves today. Have you noticed any changes in your vision lately?
Not that I'm aware of, but my eye has been a little twitchy. But other than that, no.
Okay. Have you noticed any dryness or difficulty breathing?
My nose has been like runny, but other than that, no.
Okay. Have you experienced any palpitations? Okay. And with the numbness, are you experiencing any pins or needles in your fingers?
Yes, sometimes.
What about your toes?
Not as much.
Are you experiencing frequent headaches?
Occasional. I wouldn't say they're frequent.
Okay. Are you taking any medicine on a daily basis?
Just vitamins and supplements.
Okay. Any back problems, backaches?
No, other than an injury from when I was younger, but it doesn't affect me now.
And have you noticed any ringing in your ears?
Mm.
Okay. Have you noticed any difficulty in grasping objects or strength-wise?
No, I haven't.
Okay. Any family history of neurological disorders?
I believe on my mom's side.
Okay. We're going to go ahead and do a cranial nerve exam and full body sensory to see exactly the regions that we're dealing with. But first, let's go ahead and take a look at your eyes. Okay, go ahead and look right here. Okay, go ahead and look here. Okay, I'm going to have you follow my fingers with your eyes only. Don't move your head. Okay, I'm not noticing anything abnormal there. I'm just going to go ahead and palpate around your eyes. Let me know if you feel any pain. Okay, I'm going to have you look down. Okay. Great. Check your reflexes. Go ahead and relax your jaw. Okay, I'm going to have you relax your arm. Okay. Good. I'm going to have you relax. A little bit diminished on the right side. Okay, go ahead and relax your arm. Okay. Okay. I'm going to go ahead and listen to your heart and your lungs. This is going to feel a little bit cold. Okay, I'm going to have you relax. I can hear only S1 and S2. Now S3, now S4. Go ahead and take a deep breath in. Breathe out. And again, breathe in. And exhale. Going to listen with the bell. We're listening for murmurs. I'm going to have you take a deep breath in and hold it for 1, 2, 3. Breathe out. Okay. I'm going to listen to your back. I'm going to have you turn towards the wall so that I can listen to your back, okay? I'm going to have you breathe in, breathe out, and again, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, and exhale. Go ahead and check your reflexes on the spine. Noticing a little bit of abnormality here at the last cervical. Okay, I'm going to make a mark here at the last cervical. I'm going to be able to easily erase this. And I have here a nervous scope. I'm just going to take a look and see if there is any difference in temperature. So I'm sliding it down on the paraspinal muscles. So that's about T3, T4. I'm going to have you turn around. I'll take your vital signs, then I'll have you lay down and do some more tests and see exactly what we're dealing with.
Okay.
Have you noticed any flu-like symptoms in the last 48 hours?
No.
Just going to take your temperature. 97.7. And then this will go on your upper right arm. We'll take your blood pressure. I'm going to have you uncross your legs and relax, okay? Blood pressure is 121/70. Just going to slide this down. We'll take your pulse. I'm just going to put 2 fingers around your wrist.
Okay.
Okay, I'm going to go ahead and compare. Pulses are strong and symmetric. No signs of heart failure. I'm just going to test your strength now. Go ahead and squeeze my fingers. Okay, very good. I'm going to have you put your arms like this in front of you. I'm going to test your strength bilaterally. So first I'm going to push on one arm without telling you which one, and I'm going to have you to resist, okay?
Okay.
I'm going to have you close your eyes. Good. Okay. Okay, a little bit decrease on the right side again. I'm gonna try to open your arms, don't let me do that. I'm gonna try to close them, don't let me do that. Okay, go ahead and relax. I'm gonna put my hands on your shoulders. I'm gonna have you shrug them. Okay, good. Now go ahead and try to touch your chest with your chin. Okay, relax. Now I'm going to have you turn your chin towards the left and towards the right. Okay, very good. As your eyes are closed, I'm going to have you tell me with which ear you hear this sound, right or left.
Left. Right. Both.
Okay, and I'm going to cover one nostril. Go ahead and breathe in, breathe out. And the other side, breathe in, breathe out. Okay. Okay, you can go ahead and open your eyes. I'm going to take a look inside your mouth and see if there is any swelling or redness. Have you noticed redness in the back of your throat? Okay. Go ahead and push with your tongue inside your cheek. And the other side. Okay. Stick your tongue out and move it up and down. Okay. Very good. I didn't notice any asymmetry. Color was pink and normal. Go ahead and give me a big smile. Good. And frown with your eyebrows. Okay, keep them frowned. I'm going to try to push them down. Keep them frowned. Okay, go ahead and relax. I'm going to have you change in this gown, and then I'm going to take a look at your scalp. Okay. Okay, I'm going to go ahead and put the gloves on. palpate your face first. Looking for any nodules or changes in texture. The hairline looks well defined. Just going to palpate sinuses in between your eyebrows. And right under your eyes. Let me know if you feel any pressure, any tenderness. I'm trying to figure out why you're experiencing that twitching. Could be coming from the trigeminal nerve. Sometimes there may be a misalignment, putting pressure on the nerve and misfiring the neurons that are connected to the nerve. Palpating the lymph nodes, we're looking at preauricular lymph nodes. Palpating postauricular lymph nodes. We're looking to see if there is any lymphadenopathy. Palpating the cervical lymph nodes. Trachea. Trachea's midline. Not feeling any nodules. And also right here on the bottom, we have the thyroid gland. It's not enlarged. I'm going to have you swallow. Okay, that's perfect. It's not palpable. And palpating the submental lymph nodes. They're right under your chin. ocular reflex, I'm going to have you open your eyes. Good. You can go ahead and close. Check for any swelling around the sinuses. And also to see if there is any symmetry between right and left. I'm going to have you take a deep breath in through your nose and out through your mouth. Go ahead and tell me if you can identify the smell.
It kind of smells like... Oh. Wait, can I smell it again?
Yeah, it's right here. So just breathe in.
Oh, it kind of smells garbage. Okay.
Let's do that again. This is a different smell. We're testing your olfactory nerve now.
It kind of smells more like eucalyptus. That one smells like lavender. That one smells like cinnamon. Okay.
Honestly, at some point, if we keep on going like this, your nose is going to get saturated and you won't be able to identify them anymore. So I'm going to take a break and we're going to do a taste test. I'm going to put a piece of paper on your tongue. If you can go ahead and identify what this tastes like.
It tastes like lemon.
Okay. Let's try one more.
That one's really like sour or bitter. Okay.
Okay, let's try one more.
That one's super sweet.
I'm just gonna go back to the smell. Go ahead and take a deep breath into your nose.
Oh, it smells minty. Okay.
The olfactory nerve seems to be intact. I'm gonna test your facial sensations. Go ahead and tell me if you feel this on the left or right of your face. Okay, I'm going to say that one more time. Okay, go ahead and tell me if you feel this on the left or right of your face. We're going to test your facial sensations.
Left, right, right, left. I think that was middle. Right, left, left, right, right, left.
Do you feel this cold or warm?
Cold, warm, warm, cold, cold,
Do you feel this all the way down? Does it change in temperature?
No,
What about now?
it's the same.
Okay. And is this the same as this?
Yeah.
And is this the same as this?
It felt colder on the right.
Is this the same as this?
Yeah.
I'm gonna touch you with two textures. One is gonna feel dull. This is what dull is gonna feel like, and the other one is gonna feel sharp. Go ahead and tell me if you feel this sharp or dull.
Dull, sharp, dull, dull, sharp, sharp, dull, sharp, sharp, dull, sharp, dull, dull, sharp, dull, sharp.
I'm gonna move around the hairline. Same thing, sharp or dull.
Dull, dull, sharp, dull, 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 sharp, dull,
Okay, I'm going to focus on your eyebrows.
dull, dull, sharp, sharp, dull, dull, sharp, dull, sharp, sharp.
Just checking your facial reflexes. A little bit diminished on the right side. Go ahead and relax your jaw. Take a look at the crown and your scalp. Okay. Go ahead and tell me if you feel this cold or warm.
Cold, 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 warm, warm,
feel this on the left or right of your scalp?
On the right. 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 Right.
Do you feel this 2 or 1 pressure point? Okay, go ahead and tell me if you feel this 2 or 1.
1. 1. 1. 1.
Okay, and do you feel this all the way down?
Yeah.
Okay, I'm gonna go ahead and check your back now. I'm gonna palpate. I'm looking for any deviations of the spine. Normal curvatures. Not noticing any swelling around the vertebrae. Just going to listen to your spine first. Looking for any crackling, any swishing sounds that can be heard microscopically. some measurements, looking for asymmetry. A bit of swelling on the right side. Seems like there is fluid retention. Go ahead and tell me if you feel this pressure or vibration.
Vibration. What kind of bubble? Vibration. Pressure. Vibration. 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 Pressure. Vibration. Vibration.
Do you feel this cold or warm?
Cold. Cold.
Does this feel the same as this?
The second one felt colder.
Does this feel the same as this?
Same thing, the second one felt colder.
Do you feel this cold all the way up?
Yes. Yes.
I'm going to put a gel-like consistency on the left side, and this usually helps for the sensation to be felt a little bit less. I'm gonna have you tell me what shape I'm drawing, okay?
Square. Circle.
What letter am I drawing now? Okay, what shape am I drawing?
Circle.
Okay, what letter am I drawing now? What about now? And now? Okay. I'm gonna go ahead and check your abdomen now. Okay, I'm gonna go ahead and take a look at your abdomen and see if there is any asymmetry, redness. Is it okay if I palpate?
Yeah.
Okay. First, let's go and listen with the stethoscope. It's gonna feel a little bit cold. Not hearing any abnormal sounds. Okay, this is going to feel a little bit cold. Go ahead and tell me if you feel this on the left or right.
On the right. Right. Left. Left. Middle. Middle. Left. Left. Okay. I'm gonna do the same thing. Go ahead and tell me if you
can distinguish what shape I'm drawing.
Square. Triangle. Triangle. A circle.
What number is this?
3, 2, 8, 9.
I'm gonna do the same thing on the other side. Go ahead and tell me what number you feel.
7. 7. 0.
Because there seems to be a little bit less conductivity on the right side, and it is consistent with everything that I've been noticing so far. I'm gonna go ahead and palpate your abdomen. Let me know if you feel any kind of pain. Just going to listen one more time on the right side. Going to compare with left. Going to check your reflexes on the lower part of your body. Okay, so we're gonna do some testing on this upper side. I'm going to lift the gown a little bit. Go ahead and tell me if you feel this cold or warm.
Cold. Warm. Cold. Cold.
Do you feel this the same on the right and left?
Yes.
Do you feel this the same on the right and left?
Yes.
Go ahead and tell me if you feel this vibration or pressure.
Vibration. Pressure. Vibration.
Okay. Do you feel this cold or warm?
Cold. Cold.
Do you feel this equally on both sides?
It was lighter on the left.
Do that one more time.
It was still lighter on the left.
Okay. Do you feel this on the right or left?
Left. Right. Right. Left. Right. Right. Left. Left.
Do you feel this 2 or 1 pressure point?
1. 1. 1. 1. 1. 1.
I'm going to check your reflexes. I'm going to have you relax your knee. Okay. I'm going to put the left foot on top of the right one. Relax. Okay. I will repeat. Okay. Relax. I will do the same thing. Okay. Very good. I'm going to check your toes. I'm going to have you kind of like spread your toes apart. Okay. I'm going to try to close them. Don't let me do that. Okay. I'm going to have you wrap your toes around my fingers. Okay. I'm going to try to push your feet towards you. Don't let me do that. Now I'm going to try to push them towards me. Don't let me do that. A little bit weak. Okay. I'm going to try to open them. Don't let me do that. I'm going to try to close. Don't let me do that. Do you feel this pressure or vibration?
Vibration. Pressure. Pressure. Vibration. Pressure. Vibration. Pressure. Vibration.
Do you feel this cold or warm?
Cold. Cold. Warm. Warm.
Okay, your right foot feels a little bit colder than the left one. I'm going to check your pedal pulses. I'm not noticing any peeling edema. Okay, I'm going to check your Babinski reflex. Go ahead and tell me if you feel any pain. Okay, very good. I'm going to have you stand up now, like sit back on the table, and we'll talk about the results. Okay, Angelina, it does look like there is a deficiency in vitamin B12. I'm going to prescribe a high dose of vitamin B. I'm going to have you take it once a week. Try to stick to the same day and same time every week so that you don't forget it becomes a habit. I'm also going to test your vitamin D level and see if that makes a difference and what your levels are. But I think the numbness comes from a vitamin deficiency, and once we correct that, it should get back to normal.
Okay, perfect.
Okay. I'm gonna have you run to the lab as soon as you get dressed so that we draw a little bit of sample and test for vitamin deficiency. Otherwise, if you have any questions, feel free to ask me anything. I'm here every day and you can find out whatever is concerning to you and I can help you with that.
Okay, thank you.
You're welcome. Thanks for coming in.
Thanks.
Smile and frown. Hi, Emma.
Hi.
I'm Dr. Matt. I'm going to do your exam today.
Nice to meet you.
Nice to meet you too. Go ahead and verify your last name and your date of birth for me, please.
Yeah, Archbold, Archbold, and my date of birth is 12/01/02.
Do you have any allergies?
Not that I'm aware of.
Are you experiencing any pain at the moment?
I have a little bit of neck and shoulder pain and some mild heartburn.
How long ago did the pain start?
Probably a month ago.
And is it intermittent? Does it come and go, or is it constant?
It's constant.
On a
It's hard to sleep at night.
Oh, okay. On a scale of 0 to 10, 0 being no pain, 10 the worst pain, how would you rate it right now?
Right now, a 6.
And is it sharp, dull, or achy? How would you describe it?
Like a sharp ache.
Does it radiate more on one side, or is it central, or on both sides equally?
Both sides equally.
Tell me a little bit more about the heartburn. When did it start as well?
Yeah, it started about a month ago. I started doing more yoga, so maybe there's a correlation there. I don't really recall any dietary changes.
Is the heartburn more after you eat, when you wake up, before you go to sleep?
It definitely is worse in the morning. And does flare up after I eat.
Okay. Are you experiencing any frequent headaches?
Yes.
Okay. How often?
I'd say once a day.
Okay. Are you taking any medicine for that?
Just ibuprofen.
And for how long have you been experiencing these migraines?
I thought they were normal, so maybe like 2 or 3 months.
Okay. Have you noticed any changes in your vision? Any loss of sensation?
No.
Are you experiencing any pins or needles in your fingers or toes?
Yes, in my left hand. In my hand. Yeah.
Okay. And which fingers are you referring to?
It's mostly like my thumb and my ring finger, I think.
Okay. Any surgeries or accidents in the last 12 months? Are you taking any medications besides ibuprofen?
Sometimes I take that
like an antacid for the heartburn.
Okay.
And also birth control.
Okay. And does that alleviate?
Yes.
Okay.
I like the fruity flavors.
Okay. And for how long have you been on the birth control?
A couple years.
When was your last gynecology exam?
A year ago?
Okay, what about your pap smear?
A year ago. I think it was the same appointment.
Okay. And do you remember when you had your last period? Approximate?
I think about a month ago.
Okay. Have you noticed any difficulty breathing or changes in your heart rate, any palpitations or rhythmic beatings in your chest?
Sometimes with the heartburn, yeah.
Do you have any family history of heart disease?
I do.
Okay. Mom or dad's side?
My dad's side.
Okay. Any history of thyroid disorders?
No, not that I know of.
Nor in the family, correct?
Correct.
Okay. Are you experiencing any weakness in your arms or legs?
Yes, in my arms.
Both or just one?
Both.
Okay. Do you have difficulty grasping objects?
Sometimes when I get the pins and needles in my ring finger and my thumb on my left side, it does
Okay.
spasm.
And when did you first notice this? Do you remember?
I don't know. It's been a while.
Okay. All right. So I'm going to start the cranial nerve exam and do some sensory tests to rule out any nerve damage.
Okay.
And also we'll do a full head to toe on top of that, just so that we are able to rule out anything else.
Okay.
I'm going to put my gloves on. I'm going to take your temperature first. This will go on your forehead. Any flu-like symptoms?
No, just the soreness.
This will go on your index finger. Go ahead and relax. Okay. Blood pressure is within normal limits, 118/65.
oxygenation is 72% on room air. Heart rate in the 60s. I didn't notice your hands being very cold. Is that normal for you?
Yes, I have terrible circulation.
Okay. And do you have the same, are your feet cold as well?
Yeah.
For how long have you been experiencing this?
My whole life.
Okay. So let's go ahead and continue the exam. I'm going to do a vision check. Do you wear contacts?
I do.
Okay. When was your last vision check?
A year ago.
And your last prescription?
A year ago.
Okay. Let's go ahead and look straight here at my nose. I'm going to flash a light in your eyes. Very good. Go ahead and follow my fingers with your eyes only. Don't move your head. Are you experiencing any pain?
No.
Okay. Go ahead and look right here at the light. I'm going to bring this pen light very close to your nose. Go ahead and keep on looking at the pen light. Good. Now just do that one more time. Okay. Any pain or pressure?
No.
Okay. Go ahead and look right here. Go ahead and look right here. A little bit higher. Let's go ahead and do that one more time here. Okay. Go ahead and give me one big ah. Any pain with swallowing? Okay. Tongue is symmetric and pink in color. Go ahead and give me a big smile and frown. Puff your cheeks. Keep them puffed for me. Don't let me unpuff them. Good. Go ahead and relax. I'm going to try to turn your head towards your right. Don't let me do that. One more time. A little bit weak on that side. Go ahead and the same thing. Okay. Stronger there. Just going to push down on your shoulders. I'm going to have you shrug your shoulders now. Okay. Go ahead and squeeze my fingers as hard as you can. Go ahead and just grab my fingers kind of like in a fist. Okay, that's good. Go ahead and put your arms in front of you. Have you noticed any shakiness or trembling?
A little in the...
Okay. I am noticing a little bit of redness towards the tip of the fingers. Let's go ahead and check a capillary refill. It is a little bit delayed. We want to see it within 2 seconds. Okay, go ahead and try to keep your arms straight. I'm going to push it down. Don't let me do that. Same thing. I'm going to do this both in the same time now. Okay, I'm going to try to open your arms. Don't let me do that. First, I'm going to do left. Good. Right. Both in the same time. Okay. Now I'm going to try to push it up. Go ahead and tell me if you feel any pain. Resist. Resist. Good. Resist. Resist. Okay. Go ahead and relax. Okay, going to listen to your lungs and heart. I'm going to have you take a deep breath in through your nose and out through your mouth. Take another deep breath in through your nose and slowly exhale. One more time. And breathe out. Okay. Now I'm going to listen to your heart. Go ahead and breathe normal. I can hear S1 and S2. And S3 as well. Usually we don't want to hear S3 or S4, but I think there is an S3 on your rhythm. And sometimes people can just be born with this and have nothing to worry about. So we're just going to do a few more tests. Okay. I'm gonna have you turn the other way so that I can take a look at your neck and shoulders, and I'll listen to your lungs in the back as well. Okay. I'm going to take a look at your spine. Slowly palpating cervical spine. Just noticing a little bit of redness right at the base. It does seem to be superficial. I'm not noticing any edema. Palpating the lymphatic system. I'm not noticing any changes in temperature or volume. I'm looking for any abnormalities in the curvatures of the spine. Normal scoliosis or lordosis is expected. I'm not feeling any things swollen around the paraspinal muscles. I'm going to take a few measurements. We're looking for any asymmetry, something that would indicate a degree of inflammation. About the fingertips, T1 to L1. That's 67. Just going to repeat that measurement to make sure that we have it correct. But it seems like there is just a 1 to 2 degrees difference. It's very insignificant. This is going to feel a little bit cold. Just going to measure for any swelling. Okay. Slight swelling on the right side. Let's start with T1. Right scapula is indeed a little bit lower than the left. Going to listen to your lungs. Go ahead and take a deep breath in through your nose. And breathe out. And again, breathe in. And breathe out. Again, breathe in, breathe out. Again, breathe in, breathe out. I can go ahead and just breathe normal now. going to do a few more tests. Go ahead and tell me if you feel this on the left or right of your back.
The right. Left. Right. Left. Right. Left. Right. Left. Center. Center. Right. Left. Left. Right. Right. Left. Left. Right. Right. Left.
Okay, I'm going to look for any deviations in heat disturbances around the spine level, and I will mark those points so that we know exactly where we need to focus on. There are only 3 points that seem to need adjustment. I'm going to touch you with 2 textures. One is going to feel dull. This is what dull is going to be like. And the other one is going to be sharp. This is what sharp is going to be like. Go ahead and tell me if you feel this sharp or dull.
Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp. Sharp.
Go ahead and tell me if you feel this dull all the way down.
Yes.
And does this feel sharp all the way down? Any numbness?
No numbness.
Okay. What about now? Does this feel dull all the way up?
Yes.
And does this feel sharp all the way up?
Yes.
Okay, I'm going to do a micro adjustment here. It's going to relieve any pain and tension. It's going to help with spinal movement. I'm gonna have you change into this gown and I'll have you relax on the table and we'll do a full body head to toe examination. Okay. I'm going to touch your temples. I'm looking for any tension. And sinuses right in between the eyebrows. And right under your eyes. I'm not noticing any puffiness or swelling. I'm going to palpate your lymphatic system, looking for any lymphadenopathy. Palpating preauricular lymph nodes. And postauricular lymph nodes. Moving down to the cervical plexus. Palpating supplemental lymph nodes under the jaw. Going to test your reflexes. Go ahead and relax your jaw. Good. Go ahead and tell me if you feel this vibration. Do you feel this?
I feel it.
Okay, go ahead and tell me when it stops.
It stopped.
position here is louder? Position 1 or 2?
2.
1 or 2?
1.
I'm going to take a sample. We're looking for any mycobacteria that could trigger neurological symptoms. And we're going to send this to the lab. Go ahead and tell me if you feel this 2 or 1 pressure point.
1. 2. 2. 2. 1. 1. 1. 1. 1. 2.
Do you feel this cold or warm?
Cold.
Do you feel this cold all the way up?
Yes.
Okay. What about now? Does this feel cold or warm?
Cold.
Does it feel cold all the way up?
Yes.
Okay. Go ahead and tell me if you feel this cold or warm.
Warm.
And now?
Cold.
Okay. Do you feel this warm all the way?
Yes.
And now?
Yes.
Do you feel this equally on both sides?
Yes.
Do you feel this equally on both sides?
Yes.
And this?
Yes.
Okay, I'm gonna have you open your mouth and close. What does it taste like?
Nothing.
Okay. That was the control test. Go ahead and open again. And close. And open. What does that taste like?
Nothing.
Okay. Let's go ahead and check your smell. Go ahead and take a deep breath in through your nose and out through your mouth. Let me know if you need to do that one more time.
One more time.
Okay. Are you able to identify the smell?
It's sweet like lavender.
Great. Let's go ahead and do that on the other side. Go ahead and take a deep breath in through your nose. Would you like to smell one more time?
Please.
Okay. Breathe in through your nose. What does that smell like?
Maybe eucalyptus or pine.
Okay. I'm gonna turn your head to the left. Just take a look behind your ear. Skin looks intact. I'm not noticing any redness. Epidermis is well perfused. Going to check your scalp. We're looking at your distribution, any signs of alopecia, eczema, psoriasis. I'm going to do a few tests here. I'm going to touch you with two objects. One is going to feel sharp and the other one is going to be dull. This is what sharp is going to feel like, and this is what dull is going to feel like. Go ahead and tell me if you feel this sharp or dull.
Dull. Sharp. Dull. 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 Sharp. Sharp.
Do you feel this sharp all the way?
Yes.
Does this feel dull all the way?
Yes.
Okay. I'm going to attach a neutralizer to the hair follicle so that we can collect a sample. Now go ahead and tell me if you feel this 2, 1, or 3 pressures.
1.
1. Okay.
1. 2, 1, 2, 2, 1.
I'm going to do a lymphatic massage around the ear and behind it. This is going to help stimulate blood flow to the scalp. It also helps to remove any toxins that have been accumulating in the lymphatic system. Going to turn your head just facing up. Going to check your trigeminal nerve. I'm going to just apply gentle pressure right here on your TMJ. Go ahead and slightly open your mouth. Any pain when you do that?
No.
Okay. Now I'm going to have you open it slowly as much as you can. Good, and slowly close. Okay. I'm not feeling any popping, which is great. Let's go ahead and do that just one more time. Okay, go ahead and close. Alright, I'm just gonna look now for any microscopic sounds that are really hard to distinguish. So this is gonna go just right here in front of the ear. Go ahead and slightly open your mouth one more time, as much as you can, and gently close. Okay, just a little bit on the right side. I would say you're at the maybe 2nd degree there. Go ahead and slightly open again. And close. Okay. Palpating scalp for any lumps to see if there are any asymmetries. Scalp is very mobile, which is absolutely great. Do you drink coffee?
Yes.
Okay. No signs of mastoiditis. Alright, I'm going to go ahead and move down to the abdominal assessment. Okay, Emma, I'm just going to first listen to your abdomen, see if there are any abnormal sounds before we even touch it. So just go ahead and relax. Is it okay if I lift the sports bra a little bit higher? Okay. I'm just gonna have you put your arm here, relax. Okay, this is gonna feel a little bit cold. we're starting with the right upper quadrant. Okay, moving to the right side. Okay, so the superior abdominal area sounds good. Now I'm moving to the lower part. Left lower quadrant is within normal limits. Moving to the right lower quadrant. A little bit diminished on the right side. I'm going to do a few tests. This is a solution that helps to neutralize a sensation. I'm going to draw a letter. Go ahead and tell me what letter you feel. R.
M.
G.
1 out of 4. Okay, I'm going to wipe the solution off. I'm going to go ahead and just slowly percuss. Please let me know if you feel any type of tenderness. Sometimes this movement can elicit some pain or tenderness, and we want to make sure that we are aware of it. Very normal sounds there. I'm going to listen to your abdominal aorta. We're looking for any buoy. Just going to slowly palpate. Let me know if you feel any kind of pain. This palpation is just very superficial. Okay, let's go ahead and have you turn over, and I will do another back exam. Okay, I'm going to first palpate to make sure that there is no swelling around the cervical vertebrae. No signs of scoliosis or lordosis. Very normal curvatures within normal limits. I'm going to listen to your spine. If you You want to make sure that there are no microscopic sounds. Go ahead and tell me if you feel this 2 or 1 pressure point.
1. 1. 1. 1. 1. 1. 2. 1. 2.
Okay, go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. Sharp. Dull. 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 Sharp. 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 Dull. Dull.
Go ahead and tell me when you don't feel the vibration anymore.
I don't feel it.
And please let me know if you feel this cold or warm.
One. One. Cool.
Do you feel this warm all the way? Do you feel this cold all the way? What about now? Sorry, what about now? Does this feel cold?
Yes.
Okay. Does this feel the same as this?
Yes.
Does this feel the same as this? Alright, I'm gonna have you sit back up and we're going to discuss the results. Okay, Emma, I do recommend that we get an MRI of the chest and neck just so that we rule out anything serious, but the health physical exam turned out to be really good. I didn't see any abnormalities. Everything was within normal limits. Even that you had a little bit of sensitivity or numbness in certain areas that could also be triggered by seasonal allergies or something like that. So we're gonna run a blood panel. And the CT. Do you have any questions for me? No. Okay, great. I'm gonna have my assistant reach out to you with the results and we'll let you know how everything is going. Thank you. Thank you. Exhale.
Sharp. Dull. Vibration. Warm.
Good.
One.
Hi, Sarah. My name is Dr. Mad. How are you doing today?
Good. How are you?
I'm good. Thanks for asking. So I have here your file. You're a transfer patient from another hospital. I'm just going to go over your medical history to make sure that I have everything before we do the exam, okay?
Mm-hmm.
When was your last checkup?
About a year ago.
Okay. Can you please verify your last name
Yes. Russell.
and your date of birth?
November 18th, 1998.
Okay, perfect. Do you have any allergies?
Just pollen.
Are you taking any medicine on a daily basis?
No.
Okay. Any surgeries?
No.
Okay, any recent headaches or migraines?
I've had a couple migraines in the past year.
Okay. On a scale of 0 to 10, how bad are they normally?
About a 6.
Okay, and how often do you get them?
Every maybe 5 months or so.
Do you know what they are triggered by?
I suspect stress.
Stress. Okay. Have you been under a lot of stress in the last year?
I'd say so.
Okay. Any recent changes at home or at work?
I've switched jobs twice.
Twice. Okay. Okay. Have you noticed any palpitations, difficulty breathing,
No.
any vision changes? Okay. Any skin changes, discolorations, or eczema?
No.
Okay. And how is your sleep pattern? How long do you sleep per night?
Usually about 8 hours a night.
Okay, that's amazing.
Pretty regular.
Okay. And do you follow a normal diet?
Mm-hmm.
Okay. What about exercise? How often do you exercise per week?
My job's pretty active, which helps. But usually I'll go to the gym about 3 times a week.
That's amazing. Okay. Any family history of hypertension, thyroid disorders, any neurological disorders?
I think some thyroid stuff on my dad's side, but otherwise nothing.
Okay. Alright, so I'm going to go ahead and insert this into your file since you're going to be our patient here, and we'll take your vital signs to make sure that we have a good baseline for you.
Great.
Are you experiencing any migraines at the moment?
No, not at the moment.
Okay, any pain anywhere in the body?
Some back soreness, but that's all.
Okay. On a scale of 0 to 10, how would you rate the back pain?
Probably a 2.
A 2. And is that constant or it comes and goes?
It comes and goes.
Okay. So this is going to go under your tongue. I'm just going to have you hold it for me.
Thank you.
And then this will go on your index finger. It's going to measure your oxygenation and your heart rate. And 98 to 76. Perfect. Perfect. Okay, so that is 98.6 Fahrenheit. That's very normal. Now I'm going to take your blood pressure. Is your left arm okay? So this is going to go on your upper arm. And you said there is no hypertension in the family. You're not feeling any palpitations, no headaches at the moment either. So I'm gonna have you relax your arm, uncross your legs. Perfect. Just going to place this here. Okay, this is going to go right here. Okay, I'm gonna have you relax. Blood pressure is 116/75. Okay, I'm just going to slide this down. And how tall are you?
5'4".
Perfect. I'm going to listen to your heart. So I'm just going to have you scooch a little bit closer. That's perfect. Okay, go ahead and relax. I can hear only S1 and S2, no S3, no S4. Going to listen with the bell. Go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. Okay. I'm going to listen to your lungs in the front, and then I'm going to listen to the back too. Go ahead and take a deep breath in and exhale. Breathe in. Exhale. Breathe in. Exhale. Is it okay if I listen to the back? Okay, I'm going to have you turn around towards the wall. Perfect. Go ahead and take a deep breath in and exhale. And again, breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, exhale. Breathe in, breathe out. Where is the pain located? On the back? The back pain. Can you go ahead and point it?
Oh, down here.
Lower. Or lower. Okay. And does it get worse when you're standing or sitting?
Standing.
Standing. How is the pain right now?
Right now it's fine.
Okay. I'm looking for signs of scoliosis or lordosis. which is a deviation of the spine, normal angle, and it could indicate that the vertebrae are moving, shifting in the wrong direction, and that would cause strain on the muscles around, nerve pain associated with it. I'm going to do a sharp or dull test. Go ahead and tell me if you feel this sharp or dull.
Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Does this feel the same as this?
Yes.
Does this feel the same as this?
No.
Does this feel the same as this? Okay. Go ahead and tell me if you feel this pressure or vibration.
Pressure. Vibration. 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 Pressure. Pressure.
And does this feel cold or warm?
Warm.
What about now?
Warm.
And now?
Cold.
And now?
Warm. Warm. Cold. Warm. Cold. Warm. Warm. Cold. Cold. Warm. Cold. Cold. Warm. 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 Cold. Cold. Warm. Warm.
Okay. So I'm gonna have you change into our gown, and we're gonna go ahead and do a head exam first and move down. Okay, to put gloves on. I'm going to start by palpating your face. Let me know if you feel any kind of pain. Palpating masseter muscles to check for any inflammation. Checking lymph nodes. Checking preauricular lymph nodes for any inflammation. Postauricular lymph nodes. Also, we're checking thyroid gland to make sure that there is no nodules. Both wings are non-palpable. trachea is midline. Palpating mastoid bone, which is the bone right behind your ears. Checking to see if there is any signs of mastoiditis, an inflammation of the bone that sometimes could be discovered through just regular palpation. Going to palpate your sinuses right in between your eyebrows. Sometimes we could notice a little bit of swelling, tenderness, redness. And right under your eyes. Just going to slowly palpate around the fossa, the orbital part is definitely very sensitive. Okay. Palpating the hairline to see if there are any nodules, asymmetries. I'm going to take a look at the scalp to see if there is any inflammation, if you're suffering from any disorders of the skin that may be a little bit difficult to assess. Looking at the hairline, noticing a little bit of flakiness, dandruff, so you might be having a combination of oily and dryness. But I'm not seeing any redness, so that's good. I would really like to take a sample and see if there is any fungi or bacteria that we are dealing with. So what I'm going to do is I'll apply a toner that helps to balance the pH, and then we're going to take a sample and send it to the lab. Okay. So we want to scratch off as many dermal cells as possible. This also helps to regulate the pH of the hair follicle. This is going to feel a little bit wet. Okay. So now we're trying to see if there is any redness that appears after the treatment. Okay. Normal coloration, normal hair distribution, no signs of alopecia. Okay, this is going to help to soothe any inflammation from the test that we did, just so that we balance the pH and allow for healing. Going to check your hearing. Go ahead and tell me if you feel this on the left or right.
Left. Right.
Okay. Go ahead and tell me when you don't hear the vibration anymore.
I don't hear it.
Okay, go ahead and tell me when you don't feel the vibration anymore.
No. I don't feel it.
Okay.
Stop.
Okay, go ahead and tell me which position here is louder. Position 1 or 2.
2.
1 or 2.
1.
Okay, so on the right side, there's definitely a little bit of imbalance. I'm gonna go ahead and examine your abdomen. Okay, Sarah, I'm just going to go ahead and take a look at your abdomen. First, I'm going to listen with a stethoscope. This is going to feel a little bit cold. Normal abdominal sounds. Have you noticed any swelling, any pain?
No.
Okay. I'm going to go ahead and percuss. Just a gentle palpation to check for any organ enlargement. So we're checking all 4 quadrants. Here we have the liver that usually is encapsulated under the ribs. Okay. I'm gonna go ahead and close this. I'm going to take a look at your legs. I'm just gonna go ahead and just palpate to see if there is any edema. Okay, normal temperature. Going to check pedal pulses. 2+, strong and symmetric. I'm going to check neurological response. Go ahead and tell me if you feel this vibration or pressure.
Pressure. Vibration. Vibration. Pressure. Pressure.
Does this feel cold or warm?
Warm. Cold. Cold. Warm.
Do you feel this pressure or vibration?
Vibration. Pressure. Vibration. Pressure.
I'm going to check your reflexes. I'm going to have you relax your leg. Just relax. Good. Good. Relax. Okay, a little bit diminished on the left side. I'm gonna have you relax and just twist this. Perfect. Good. Same thing on the other side. Okay, very good. Go ahead and relax. I'm going to check your Babinski reflex. Good. Let me do that one more time. Okay, very good. Just looking in between your toes to see if there is any eczema, dryness. Maybe we can recommend like a special cream that can help with that, especially when you stand up for a longer period of time. It could affect our feet as well. I'm going to move your big toe either towards you or towards me. Go ahead and let me know which position you feel.
Towards me. Towards you. Towards me. Towards me.
Okay. Go ahead and wrap your toes around my fingers. Okay. I'm gonna push towards you. Don't let me do that. Okay, I'm going to push them away. Don't let me do that. I'm gonna try to open them. Don't let me do that. I'm gonna try to close them. Don't let me do that. Okay, good. Motor strength there. I would say 4 out of 5. That's perfect. Okay. I know I already palpated your back, so I'm going to go ahead and listen for any abnormal sounds. You can go ahead and just breathe normal and relax. Hearing a little bit of crackles at the base of the lungs. But only on the right side. I'm not sensing any inflammation around the spine. It is normal size. going to check hydration status. Go ahead and tell me if you feel this 2 or 1 pressure points.
1, 2, 1, 1, 2, 2, 1, 1, 2, 1, 2, 2, 1, 1, 1, 2.
Okay. The same thing. Go ahead and tell me if you feel this 2 or 1.
1, 1, 2, 1, 2, 1, 1, 2, 2, 1, 1, 2, 2, 1, 2, 1, 1, 2, 1, 2, 1, 2, 2, 1, 1, 2, 1, 1.
Take some measurements to check for asymmetry. Forty-two. 18.5. 'Cause there's about a 2-degree difference, which is not indicative of inflammation in the back area. I'm going to go ahead and run a few more tests, and we're going to take some x-ray of the back just so that we rule out any scoliosis or lordosis of the back spine. Okay, something that could definitely explain your back pain and also the migraines. So I'm going to have you get dressed and we're going to discuss the results. I'm going to take off my gloves and I want to do a one quick exam. So check your vision and your pupil response. There you go. Okay, so I'm gonna have you look right here. Okay, I apologize for the light. Go ahead and look up for me. Okay. I'm not noticing any yellowish discoloration. Okay, eyes are symmetric. Go ahead and look right here. Look right here. Okay, how many fingers am I holding?
2.
Go ahead and cover one eye. How many fingers am I holding now?
2.
Okay, go ahead and cover your other eye. How many fingers am I holding now?
2.
And now?
1.
Okay, very good. Okay. So, Miss Russell, everything looks good. I think the migraines might be from a lack of caffeine, so I do recommend that you start a low dose of caffeine. That will help to stimulate your nervous system, and take it only as needed, so it doesn't have to be on a regular basis. Just probably when you feel like you get a new migraine. Okay? And then we're going to run some x-ray of your back just to check for any scoliosis or lordosis, something that could definitely either trigger the migraines and the back pain. But otherwise, everything looks good. And I'm hoping that the x-ray will reveal what we're looking for.
Sounds good. Thank you.
You're welcome. Just gonna go ahead and write this down. So, do you have any questions for me?
No, I don't think so.
Okay.
Sounds good.
Thank you so much for coming in. I'll see you soon, okay?
Yes.